Diabetes is a chronic metabolic condition that affects how the body utilizes glucose, sugar, in the blood. There are essentially two main types of diabetes, type 1 and type 2. Type 1 diabetes. Cause: it is generally considered an autoimmune disease, where the immune system mistakenly attacks the beta cells in the pancreas responsible for insulin production. Insulin: as a result, the body either does not produce insulin or produces very limited amounts, meaning glucose cannot enter cells to be used as an energy source. Onset: it can develop at any age, but is typically diagnosed in children, adolescents, or young adults. Treatment: the primary treatment is insulin administration through injection, as individuals with type 1 diabetes depend entirely on this hormonal replacement. Type 2 diabetes. Cause: it is generally associated with insulin resistance, where the body's cells do not respond properly to insulin action, or insulin production is insufficient. Insulin: initially, the body may compensate for insulin resistance by producing more insulin, but over time, production may decrease. Risk factors: it is strongly related to genetic factors, lifestyle, obesity, lack of physical activity, and aging. Treatment: it may involve changes in diet, increased physical activity, oral medications, and, in some cases, insulin. In certain situations, bariatric surgery is also considered. Here are more specific details about the signs and symptoms associated with diabetes. 1. Increased thirst, polydipsia. Polydipsia, a classic symptom of diabetes, results from a complex imbalance in electrolytes and osmolality. When blood glucose levels exceed the renal reabsorption capacity, glucose drags a significant amount of water into the urine. This leads to intracellular dehydration, activating thirst receptors in the hypothalamus. Thus, the cycle of polydipsia begins. Cellular dehydration further contributes to blood viscosity, exacerbating polydipsia. The constant search for fluids is the body's attempt to restore fluid balance and minimize excessive glucose concentration in the blood. 2. Frequent urination, polyuria. Polyuria in diabetes is a complex phenomenon originating in the renal tubules. Elevated glucose in the glomerular filtrate creates an osmotic gradient that impairs efficient water reabsorption in the renal tubules. Consequently, there is excessive excretion of water, electrolytes, and glucose in the urine. Nocturnal polyuria, common in diabetes, is amplified by increased glycosuria during the night, contributing to fluid and electrolyte loss. This electrolyte and fluid imbalance, associated with polyuria, contributes to dehydration and other symptoms. 3. Increased hunger, polyphagia. Polyphagia in diabetes reflects a complex hormonal and metabolic cascade. Insulin resistance and the subsequent inadequate uptake of glucose by cells create a scenario of intracellular hunger. The increased release of hormones such as glucagon, cortisol, and growth hormone signals the need for more energy substrates. The decrease in satiety signaling, combined with insulin resistance, leads to insatiable appetite. This complex physiological response results in the relentless search for food, especially those rich in carbohydrates, to compensate for energy deficiency. 4. Unexplained weight loss. Weight loss in diabetes is a consequence of complex metabolic processes. Insulin resistance prevents cells from efficiently using glucose for energy production. As a result, there is an increased activation of lipolysis and gluconeogenesis to meet the body's energy demands. The breakdown of triglycerides and proteins results in substantial weight loss. Additionally, dehydration associated with polyuria contributes to the decrease in total body mass, creating a picture of unexplained weight loss. 5. Fatigue. Persistent fatigue in diabetes is a multifactorial symptom derived from metabolic and circulatory imbalances. Insulin resistance hinders the effective entry of glucose into cells for ATP production, resulting in cellular energy deficiency. Processes such as beta-oxidation and glycolysis are affected, leading to a dependence on alternative energy sources, such as lipolysis. Dehydration following polyuria intensifies fatigue by reducing plasma volume, compromising the transport of oxygen and nutrients. Thus, fatigue in diabetes is a complex interaction between metabolic, hemodynamic imbalances, and energy deficiency. 6. Blurry vision. Blurry vision associated with diabetes originates from physiological changes in the optical properties of the eye. Elevated glucose levels can lead to the formation of sorbitol and fructose in the vitreous fluid, causing changes in light refraction. This phenomenon can result in temporary symptoms of blurry vision. Additionally, diabetic retinopathy, a common vascular complication, significantly contributes to visual problems. Neovascularization and macular edema are critical factors affecting the structural and functional integrity of the retina, further worsening visual disturbances. 7. Slow wound healing. Slow wound healing in diabetes is a process compromised by a series of factors. Elevated blood glucose induces damage to blood vessels, reducing local blood flow. This limits the delivery of essential nutrients and oxygen to healing tissues. Leukocyte dysfunction associated with elevated glucose impairs the immune system's ability to combat infections, further delaying healing. The reduction in the production of growth factors and collagen contributes to inadequate tissue repair. 8. Recurrent infections. Increased susceptibility to infections in diabetes results from complex immune dysfunction. Elevated blood glucose compromises the function of leukocytes, especially neutrophils, undermining the body's ability to fight pathogens. Protein glycation, a consequence of chronic hyperglycemia, alters the effectiveness of antibodies and adaptive immune responses. This pathogen-friendly environment increases the risk of recurrent infections, common in areas such as the urinary tract, skin, and mucous membranes. 9. Tingling or numbness in extremities, neuropathy. Diabetic neuropathy is a debilitating complication that emerges from prolonged exposure to elevated glucose. This condition results in progressive damage to peripheral nerves. Elevated glucose induces oxidative stress, inflammation, and direct nerve damage, leading to demyelination and axonal injury. Tingling, numbness, and pain in the extremities are early symptoms of diabetic neuropathy. Reduced nerve conduction, associated with changes in sensitivity and motor function, contributes to the high incidence of ulcers and foot injuries in diabetic individuals. This detailed explanation provides an in-depth analysis of the biological mechanisms underlying each of the symptoms of diabetes. Effective management requires not only glycemic control but also specific interventions to mitigate the different aspects of diabetes-related complications. Regular follow-up with healthcare professionals is essential to optimize treatment and improve the quality of life for affected individuals.